June is Men's Health Month, so we wanted to highlight some of the most common health concerns for men and what to do about them.
Alice Gaynor spoke with our Dr. Mallika, who's been an urgent care physician for more than 25 years, about the issues she sees in the clinic.
Dr. Mallika, thanks so much for being on call this morning. Want to begin, so it's important to point out that a lot of men don't seek health care, or they're much less likely to than women. Why is that? What's the impact?
Yeah, so we know that men are less likely to go to the doctor compared to women. And actually, it was a Cleveland Clinic study that found that only 3 out of 5 men get annual physicals, and over 40% go to the doctor only when they think they have a serious medical condition. Why is that? Well, some may have traditional beliefs that men are supposed to be strong and tough it out, and that seeking health care is a sign of weakness. Some men may be afraid to find out something's wrong. Others may be embarrassed about their symptoms, or think they don't have the time to go to the doctor, or believe they can't afford it. But of course, as we know, delaying health care can lead to serious life-threatening health problems that could be much more costly in the end.
Now, you've been an urgent care physician for more than 25 years. So what types of conditions bring men in particular to urgent care?
Well, men present to urgent care with many of the same things that women do, but today let's really focus on men. The #1 reason men seek urgent care is for upper respiratory infections, things like the common cold, the flu, bronchitis, sinus infections, and sore throats. And there has been some evidence to suggest that man flu exists. In other words, that men may experience more severe or prolonged flu symptoms than women, but the jury is still out on that one.
I've heard of man flu before. So are men more prone to injuries?
Yeah, so a lot of men participate in recreational sports or weightlifting and jobs that require physical labor, and so they're more likely to be involved in altercations and motor vehicle accidents, and often come in with twisted ankles or knee sprains, groin pulls, shoulder pain, facial injuries, and head trauma. And a lot of men develop low back pain even if they're not particularly active. Now, minor injuries can be treated with anti-inflammatory medications and rest and ice and physical therapy.
Now, what about stomach issues? Are those common among men?
Of course, yeah. I mean, it could be from stomach upset because of something that they ate. It could be from the stomach flu. It could be from food poisoning, gastritis, acid reflux, or heartburn, often from eating those fatty foods or drinking too much caffeine or alcohol. And men can also have more serious GI conditions like gallbladder disease, pancreatitis, diverticulitis, or appendicitis.
Now, you see a lot of conditions in urgent care, but are there some symptoms that are not appropriate for urgent care and, men should maybe go straight to an ER instead?
Yes, so this is not a comprehensive list, but anyone who's experiencing chest pain, shortness of breath, severe pain, loss of consciousness, overdose, signs of a stroke, vision loss, severe bleeding, or significant trauma, these folks really need to call 911 or get to the closest emergency room.
Okay, very helpful. Dr. Mallika, thank you so much for joining us.
Thank you.